Doctor at Home is a self-monitoring solution for stay-at-home patients with COVID-19 diagnosis. It consists of three key elements. Monitoring at home optimizes scarce resources for clinicians and improves the quality of life for patients. Proactive data collection, accessible, proactive data collection that works particularly well for elderly people and with low-cost unconnected devices. And intelligent triaging support, machine learning model for triaging supports clinicians in decision making, for example, if a patient needs to be visited or even transferred into the hospital. Governments have started to hand out thousands of low-cost pulse oximeters to stay-at-home patients diagnosed with COVID-19. Clinicians, however, are expected to reach out to each patient at least 3 times a day to check vital parameters, such as blood oxygen saturation. This approach would overload our healthcare systems, as we, unfortunately, anticipate the many thousands of infections coming up. Also, we can't really rely on patients to provide responsible clinicians with updates multiple times a day. Our solution, therefore, proactively reaches out to patients by phone to gather health data frequently. Clinicians then work with a dashboard of their assigned patients. They get instant alerts when a triage level changes or when there are other reasons to check back with the patient. Pulse oximeters. Patients or authorized individuals can measure health parameters like blood oxygen saturation, pulse, respiratory rate, and body temperature, non-invasive and in a safe environment. The focus group, elderly people. The most vulnerable risk group for COVID-19 patients include elderly patients. It's therefore crucial to design a system that supports this focus group. Currently, we support calling the patient via phone or an integrated voice system. This has proven to work especially well for elderly people, as well as in scenarios of remote locations like rural villages or the Alps, where there might be only landlines available. To summarize, Doctor at Home supports clinicians to closely monitor the COVID-19 patients that are confined at home. The solution reduces workload from clinicians and supports the medical triage. It helps optimize scarce clinical resources while reducing infection exposure for patients and clinicians, and improves patients' quality of life by being able to stay home with their families as long as medically justifiable.